Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McCrae.
In 2015, during the State of the Union address, President Barack Obama launched the Precision Medicine Initiative. Precision medicine is a new approach to disease treatment and prevention based on people's individual differences in genes, environment, and lifestyle. The goal of the Precision Medicine Initiative is to have 1 million or more U.S. research participants who will share biological samples, genetic data, and lifestyle information with researchers in an effort to develop more precise treatments for many diseases and conditions. In May of 2016, Mayo Clinic was awarded $142 million in funding over 5 years by the National Institutes of Health to serve as a National Precision Medicine Initiative Cohort Program Biobank.
Dr. Kathy Hudson is the Deputy Director for Science, Outreach, and Policy at the National Institutes of Health, and she's leading the planning and creation of the President's Precision Medicine Initiative. Dr. Hudson is in Rochester, Minnesota to speak at the Individualizing Medicine Conference being held by Mayo Clinic Center for Individualized Medicine. We are very pleased to have her join us here on Mayo Clinic Radio. Welcome to the program, Dr. Hudson.
Glad to be here.
So, I think once the president started talking about this, it became actually real for a whole lot more people, politicians included. Is that fair to say?
It is, and we have been really excited that the Congress, whose money we will need to actually support this program, including the Mayo Clinic Biobank, is really enthusiastic. And they're enthusiastic in a way that crosses party lines and crosses Capitol Hill. So House and Senate, Democrats and Republicans really supportive of this project as we're getting it launched.
So if I was a person sitting at home listening to this, what exactly does Precision Medicine Initiative Cohort mean to me moving forward?
So we are not yet accepting volunteers into the program. We hope to launch this winter or spring. And when we launch, we'll have a national campaign that will really explain what the motivation and the contribution that individuals can make by participating in this program. So we'll want people to enroll, provide information about themselves, either on a smartphone or on an old-fashioned phone or online, be able to get somewhere where they can get a baseline health exam, provide biological specimens, which will be flown in here locally, and also be able to provide an electronic medical record if they have one available.
Now, there already is a biobank that's up and running here at Mayo Clinic. Is the National Biobank going to be similar to what we have here in Rochester?
Yes. So we really are building on the expertise and infrastructure that you already have here and are adding to it. So there's going to be new construction in order to accommodate the number of specimens here. So if you think about 1 million people and we're getting multiple tubes of blood plus urine, and then there will be the collection at the time that people sign up, but then there'll be additional collections over time because it'll be the longitudinal changes and biomarkers and other things that will be interesting. So when fully operational, I'm pretty sure this is going to be the biggest biobank in the world.
So when you mention biomarkers, what do you mean by biomarkers?
So what analysis will be done on those specimens is to be determined, but one of the real values that was expected when we were in the early planning phases is that we would be able to do genetic and biochemical analysis on the biological specimens and be able to find correlations between health outcomes. So if you have samples from people, electronic medical records, and their own information for many years, and then they develop a disease, you'll be able to take people like that and really be able to detect what are the early molecular and chemical changes that are happening in those people that later result in the onset of disease.
I think folks might, if this is the first time they're hearing about this, they're probably thinking, I'm not sure I want people nosing around in my genome. Why should people be encouraged and want to be part of this?
So we did a survey about a year ago and asked a representative sample of people with a good representation across all demographic groups We told them about the study. We asked if they thought it should be supported, and overwhelmingly people said, yeah, this should be done. This is something appropriate for our country to do. And then we asked, would you be interested in participating? And a modest majority said that they would be interested in participating. Most interestingly, it did not vary across racial or ethnic groups. It was high amongst all of them. The variability came with age, actually. So older Americans were less likely to say that they would participate, maybe keeping in mind that it might be hard for them to be able to participate. And so we hope to be able to address that concern as we move forward. So in terms of will people be concerned about what kinds of information will be generated and who's nosing around in their medical information, not just their genome, but other health-related information and lifestyle information? And the answer is there will be some people who will be so worried about that they won't sign up, and they shouldn't, right? The wholesome number of people to participate, I think we will have no problem in achieving. So, but we will want to tell people that their private information, their identifiable information will be very strictly controlled, and that what they get back is information that we learn about them and about the cohort in an ongoing way, so they can sort of choose their own adventure. They can select how much information they want flowing back to them. And we hope that they will give us insight as we go about what kinds of science and what kind of analysis they would like to see happen. So this is a level of researcher participant partnership. So we sort of banned the word research subject, which is commonly used. We just don't use it. We talk about partners, we talk about participants, and we've really sort of instantiated that in everything that we do, which is a real turnaround for how you normally do science. You sort of think, I got to be good to my participants. I've got to make this meaningful and understandable, but it's usually after the design phase and when you're implementing, and we're sort of putting them right at the drawing board.
But the phrase research subject does help you understand exactly what is going on. You are helping research for future generations and medical discoveries.
Yeah, although, the other way of hearing the word subject is you're subjected to something. But the underlying motivation really should be one of altruism. And when we asked people in our survey, sort of, what do you think about the value of participation? They said, I would want to learn about myself. I would want to contribute to generalizable knowledge. And then, some people said that they would want other things. We offered a whole list of things, but nothing met getting information about myself was the biggest motivation for people.
No, I think this is fascinating. I was very excited when the president launched this initiative. For example, in orthopedic surgery, we can have the same condition treated by the same surgeon in two different patients and have very different outcomes. And so in certain conditions, there are factors that the patients have that we still don't quite understand. For example, why may somebody form scarring and the other doesn't? And if there's something we could do preoperatively, for example, to prevent that from happening, I think is an amazing thing to do.
Right. Yeah, it's an exciting time.
The last thing that I just wanted to ask is Rochester, Minnesota, where Mayo Clinic has a biobank, and it has been in operation, and researchers are already using information that's in there. What are some of the exciting things that you've seen in regards to that?
I didn't understand your question.
That's okay. Have there been any results from research that has been done already with the biobank here at Mayo that you've learned about that has been impressive to you?
Well, Mayo and overall is just an amazing place, and certainly the research that's been enabled by your specimens in your biobank and the real dedication to research, clinical care, and education is phenomenal. The first lab experience I had was actually here at Mayo Clinic when I was in college at Carleton College down the road. So it's nice to come back. Certainly has changed a lot in the intervening years.
Well, we'll look forward to speaking with you again. Hopefully you can come back and brief us again.
Great. Thanks a lot.
We've been talking about Precision Medicine Initiative with Dr. Kathy Hudson from the NIH. Thank you for joining us, Dr. Hudson.
Thank you.